So, as I was saying, so this is the last level of exam. So we've talked about kind of process or implementation level. We've talked about kind of like intermediate levels, like looking at some immediate outcomes, pre and post. Now we're talking about long-term evaluation, long-term things that we might be looking at. So you'll hear people, CDC will call this long-term evaluation more impact evaluation. And I've kind of, talked a couple weeks ago about how they use impact and outcome differently than outcome. So people that went to schools of public health usually refer to this longer term evaluation as outcome evaluation, whereas CDC will call it impact evaluation. So just know that when you're talking to people, you might need to clarify what, they'll say, oh, well, we're doing impact evaluation, blah, 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 blah. You might want to say, what exactly do you mean by impact evaluation? Are you talking about more short-term changes, or are you talking about more long-term changes? So, going back to our lovely pre-seed, proceed model that last semester, this semester. So now where we're really getting at is really at the health level. There might be some behavioral and environmental changes here. It just really kind of depends how far out this is. Like if you're not looking at behavior change for several years, then you might be looking at a more long-term or more outcome, as it says here, or impact, depending upon who you're working with, type of evaluation. But health for sure definitely falls in this level. Okay? So looking at long-term effects, you're going to be looking at changes in health status, okay, which you're going to get from your epi data. You're going to be looking at behavior change, so not the immediate changes, but more of the sustained changes. Like, are they maintaining this behavior change 6 to 9 months after an intervention? Okay? And then you're also looking at environmental changes. Okay, so with the health status changes, again, think back to what we talked about before. We're looking at changes in terms of rates of morbidity, mortality, but also incidence, so the number of new cases of disease, prevalence, the number of existing cases of disease, and then death rates as well, which kind of fits in with the mortality rates. Okay, and again, understand that that takes a little bit of time to collect all of this data. So the challenges. Big challenge, obviously, is that changes in health status can take a long time to occur. And think about it in terms of, like if you're doing a chronic disease, say like cardiovascular disease, changes in health status are going to take longer. Or if you're working with children, it's going to take a long time. If you want to decrease risks of cardiovascular disease in children, well, you won't see changes in rates in cardiovascular disease. We're talking elementary school, probably not for 50 years. So, some of this becomes kind of theoretical. It's some of it because it just takes a long time. Some things you can see changes in health status with. So, for example, if you look at like HIV prevalence rates or incidence rates, teen pregnancy rates, teen birth rates. You can see those relatively quickly, but some things are going to take longer to change. And depending upon how large your population is, it may take longer too. Also, sustained behavior change takes time. Excuse me. So, what is it they say that a habit, it takes like 16 weeks of doing something almost every day before something becomes a habit. So obviously to change that and to keep that change for an extended period of time, like say for 6 months or more, takes even longer. And then if it becomes a behavior that's not done every day or on a regular basis, then it becomes even harder to see that behavior change. So think about sustained behavior change, and this will have implications too in terms of your evaluation design. So if you're now talking about, okay, well, we want to know whether or not people sustain their behavior change, now that means you're not just collecting data immediately post-intervention, but it also means you're collecting data further out in order to make sure there's actually sustained behavior change. Another issue is, and this isn't just a Nevada issue, this is a general issue, is that data lags behind. Okay, so we're already into 2017. 2018. 2017 data hasn't been released yet from the feds on certain things. So some of your state data, unless it's coming from the state health division or the state division of public and behavioral health now, if you're waiting for it to come from the feds, it's going to take most of 2018 before the 2017 data gets released. So understand that when if you're doing any kind of evaluation, that's what's going to happen. That it's going to take time for that data to get there. So you may be funded, like let's say through June 30th of 2018, if you're doing any kind of long-term evaluation, looking at, even if you're using BRFSS data, that still also lags behind. So you're talking about first of all, you developed your project based on, like if it's a 5-year project, so you got funded in 2013, you maybe developed your project based on 2011 data, and now in 2018, your results are going to be based on 2016, maybe 2017 data. So you're always going to have that issue, and so you've got to be able to reconcile it, within yourself. Because some people want to be able to say, see, our program did this, and they want to have the data that actually shows it. And the problem is that data lags behind. The other part, and the key part, is you may not be funded to evaluate this. I think that's really more of the big long-term picture, is that most of you may not be funded to evaluate it. So you're not going to be looking at that. So when, for example, we had our teen pregnancy prevention grant, we weren't funded to look at that. I mean, we were only funded really for evaluation in terms of just process level evaluation, and that's all we had to report. And, as far as the feds were concerned, as long as we implemented that intervention as it was supposed to be implemented, then we had good data and we knew that we would have an impact. And so we actually did see, when we started the project, Nevada was like number 2, number 3 in terms of teen pregnancy rates. We had, good old Nevada, we had them high rates. But we dropped down during the 5 years to like 5th or 6th in the country. Which, some people will go, well, you're still in the top 10. Yeah, but when you go down that significantly over 5 years, and that was really in less than 5 years, that's pretty significant. So you know, of course, all the teen pregnancy prevention projects took credit for that. How much of that, you know, was really related to our projects? I always questioned, but I was, you know, always the first one to say, yes, but our rates in Nevada went down, and, you know, we were targeting high risk, blah, 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 you know. So, you know, it's all about that game and that strategy and stuff like that. So, wow. Yes, ma'am.
So, if you're trying to create some sort of evidence-based program, or like BART, for example, was already evidence-based,
Mhm.
right? But if you're trying to do something new and you don't get funded for evaluation, does that kind of impede your ability to prove that?
You would apply under a different funding stream.
Okay.
So, if you're just doing what they call replication and you're implementing evidence-based interventions, then you probably won't get funded to do this. If you have a new idea, now you're gonna have to build that in.
Okay.
And you're gonna have to build in some kind of control trial of the intervention. So you're gonna have to develop it, you're gonna have to pilot test it, and then you're gonna have to go to some type of a control trial situation where you've got one group that's getting the intervention and one group that's not getting the intervention, so that you can compare the results.
Thank you.
Mm-hmm.
Why does it matter if the data lags behind? I guess like I could understand if you're like prior to your program, you want the data to like give the rationale for the program, but like once you start the program, what you're evaluating are the people in your program, right? Like not so much the state level data or whatever. So why does it matter like afterwards?
But see, part of the problem is like your health status data, you may not have on. So like let's say for example we're doing HIV rates. Okay, you may be implementing an intervention, or let's say you're doing a social media campaign, so you're not directly dealing with anybody, but you want to say it has an impact on the HIV rates. Well, you got to understand that the data is going to lag behind, and so you're going to want to talk about the success of your program, but you're going to have to keep in mind that you don't have the most recent data, especially if you're not dealing directly with people. So, I mean, and there are social marketing campaigns, you know, that are evidence-based interventions that people do. So, the other part too is, you know, like, again, because you may not be funded for that, but you want to know whether or not you're making a difference. So, you know, depending upon what's going on, you know, health status wise, or even, you know, like behavioral risk wise, you know, if you're trying to watch the trends. So, you know, like if you're talking about teen pregnancy, you may be looking at YRBS and how many kids are having sex, how many kids are abstaining, how many kids are using a condom, you know. So you would be looking at those long-term trends over in terms of what's going on.
Things like Zika's new, right? So if you're trying to do like Zika prevention, you're not going to have numbers about Zika prevention from 2011.
Right, right. So yeah, when was that? 2016, they had Zika. And then was it late 2017? They said Zika had been eliminated. So, yeah. So that your data kind of lags behind, and really that becomes important, like for people when you're trying to justify, here's why we have this funding, here's why we're doing what we're doing. You just need to, they'll say, well, why don't you have, it's 2018, why aren't you presenting 2018 data or 2017 data? And you have to, that data lag is going to be the main piece here, because you're talking about oftentimes larger national data sets or numbers that are coming from CDC or whatever, and it takes a little bit longer. Okay, so no, I was laughing because the bottom line is that depending upon your job, you're probably not going to do this. I mean, we talk about it, and we have to talk about it, because if you're looking at review articles, you'll want to know kind of long term, what did somebody find? What were their impact or their outcome evaluation? And what their results were. But for the most part, in terms of the way the federal funding is working now, you know, they're not looking to do this type of evaluation. So they aren't really saying. And even, you know, like I was thinking, even like with the new interventions, they will often show that if you can, so like if you can change behavior and kind of make it sustained, so you know, looking at that, then you're not going to be looking at the health status changes, because they're going to say, okay, we know that if we get people to use a condom, we reduce their risk of HIV. Or if we get women who are at high risk for HIV in for prenatal care, then boom, we've reduced the risk of perinatal transmission. So, you know, some of this becomes like a theoretical thing, because they're like, we know what will reduce, or we know what will stop these things, you know. So, you know, like the big, you know, part of the big push with obesity is if we can get obesity rates to go down, then we know that we'll reduce rates of diabetes, cardiovascular disease, things like that. So they're not looking long term necessarily at those outcomes as they are at more intermediate kind of outcomes. Okay? So, and then this is why it was even more funny when she walked in. So, but I do have a case study I want you guys to work through. It'll help you in terms of getting ready for your exam.